here is my high voltage machine. Here's my bell, timer, negative, positive charge, hand sanitizer. Here is my room scan. Circulating, circulating, circulating. My grandmother, who's my patient, and my mom, who's filming. Okay. All right. Good morning, Miss Malinsky. How are you doing today?
I'm fine, thank you.
Good. My name's Monica. I'm a student physical therapist, and I will be working with you today. So I know I saw on the records that you did get a right total knee replacement. Is that correct? Is that correct?
Yes.
Okay. So so there's definitely some swelling in that area. So we kind of want to reduce that swelling, and I want to try today. It's called a high voltage pulse current. So pretty much this high voltage pulse current is like an electrical stimulation, and it will help kind of decrease that edema. So just so you have an understanding of how this machine works, it's pretty cool. So what it does is, so we want to essentially move this fluid, and we want to move this fluid towards your heart. So that is our central circulation. Move it towards the heart. And in order to do that, we place two electrodes. So here are these electrodes. We got a negative and a positive. And we want to use the active negative. Oopsie, I dropped that. We want to use the negatively charged because we want to target those ions that are in the fluid. So these are the plasma proteins. The plasma proteins are in this edema fluid, and we want to move it. So how do we move it? We place that negative one that I showed you onto that edema location, which is your knee in this case. So we'll place it right around here, and because these plasma proteins are negatively charged, we place another negatively charged pad onto that area. So they repel off each other, because you know how opposites attract? The two negatives repel off each other. So when we repel, they start moving. When the fluid moves, we also place a dispersive pad, which is going to be positive in this case, and the negatively charged ions, the plasma proteins, get attracted to that positive. So that's why we place it right around here, because we want it going towards the heart. Since they attract, so they go towards that heart. And while this is all happening, we also, in this process, it will also help decrease that blood flow by decreasing that vessel diameter. And also this may cause to decrease the pore size in the microvessel. So overall, we're going to help decrease that edema. Is that something you want to try today?
Okay.
Yes.
Thank you.
Cool.
Yes.
All right. Perfect. So good thing that we got their consent. Do you have any other questions about this high voltage?
No, thank you.
Okay. So again, I'm going to be placing these electrodes, and I'm going to use this nice wet washcloth to wipe off any kind of dirt or any excess material, just so we can get those adhesive sticks. Is that okay?
Yeah.
Okay, perfect. And I also checked on your medical chart, but I also want to confirm with you. So you don't have any cardiac disease or any unstable arrhythmia, pacemaker, anything like that?
No.
No, okay. And then I know you don't have any type of impaired sensation, because last time you were here, we did do a sensation testing. So specifically in this area, we tested for vibration, light touch, and fast pain. So there was, so your L3 through L5 and S1 and S2 are intact, which is good. So we are actually okay to go. Perfect. Okay, so we can get started. So I'm just gonna move my chair here. And before we do that, I just wanna make sure we get that nice edema too, kind of just to reduce it. So we wanna have that leg elevated. So can I place these pillows right under you?
Fine.
Perfect. Okay, and I'll just lift that. Okay, perfect. We just want to make sure it's high enough to go towards that heart. We'll do one more pillow just in case. Lift that one more time for me. Gentle. Okay. Good. Relax. Perfect. Is that okay?
Okay, right.
Okay, so again, I'm going to get that wet washcloth, and I'm just going to get around this area because I know you have a big scar here, so I'm going to be gentle. Okay. Alright, and I'm going to move this machine towards you. before I turn on the machine. Since I wiped that down, I just want to check to make sure everything's intact, so I don't see any type of skin integrity or muscle tone that's abnormal, so we're good to go. So again, like I told you, Ms. Walensky, we want to do the negatively charged. So this is the active pad. We want to place it, we don't want to place it right on your scar area, so I'm just going to place it just a little bit on that lateral side. So I'm going to place it right around here, about 2 centimeters.
Okay.
And if my camera lady would like to come closer to see, it's about 2 centimeters from that area. And then we want about 6 to 8 inches for this dispersive pad. So I'm just going to roll this up, that's okay.
Yes,
Okay,
okay.
so we're going to about 6 inches, 1, 2, 3, 5, 6. And I get right on that belly of that rectus femoris muscle, so that should be good. Okay. All right, double check everything's good. And then this again is my my black negatively charged and my red positively charged dispersive pad, and this is my active pad. Okay, so I'm going to turn this machine on. So turning my machine on here. And what I want to do is I want to set this for a high voltage pulse current. We want the polarity to be negative because we want to repel those plasma proteins. Ramp time we don't necessarily need in this case, so we're going to have it at 0 seconds. Display, we want it in volts. Pulse duration in the machine, but for this case we want it for 75 microseconds. Sweep time, we want it on continuous. Frequency, we want it at 100 pulse per second, and then the cycle time is going to be on continuous, and then in a total treatment, this is only going to take about 30 minutes, okay?
Okay.
Okay, 30 minutes. And then also Ms. Walensky, so right now you're not really feeling anything, but once I start turning on that intensity, I'm going to go slowly up until you feel this nice tingling sensation. So just let me know when you start feeling that, okay?
Okay.
All right, so I'm going to start turning that intensity up, and you let me know when you feel that.
I'm fine.
Right there? You feel
Yeah.
that little tingling
Just
sensation?
a little bit, it's fine.
Okay, good. So we'll stop it here. So that's at 30 milliamps. And I have that timer again for 30 minutes. So I'm going to start that machine. So we're going to leave it at that. I'm going to just double check to make sure nothing's abnormal. And Ms. Walensky, I'm going to leave you with a bell if you have any other questions for me, or if anything just feels really weird or abnormal. And then the timer again is set for 30 minutes. So I'm just going to place it right here.
Okay.
All right. So we're going to fast forward. I'm going to be back in 5 minutes to check up on you, okay?
Okay.
So 5 minutes later. Okay. So is everything okay? Is that intensity
Yeah,
still good?
fine. Yeah.
Okay.
I'm so good.
All right. I'm just going to double check to make sure everything's still okay. So again, nothing's abnormal with skin or muscle tone. All right. So Ms. Walensky, I'll be back after the 30 minutes have ended, okay?
Okay.
So fast forward again. So 30 minutes have ended. All right, Ms. Walensky, I'm going to just turn off this machine. Make sure the dials are all back to 0. Okay, I'm just going to double check. All right, I'm just going to start removing these electrodes off you, okay?
Okay. Okay.
All right. Wipe that down. Okay, again, nothing's too abnormal, just slightly pinkish, so nothing abnormal. And how did that feel for you?
I'm fine. Thank
Good?
you. Thank you.
Okay, so take this all off. Alright. So overall, Ms. Walensky, we did this high voltage pulse current today. So what do I want to do? I want to check for next session to make sure that maybe this edema, not maybe, but to make sure that this edema had decreased. So we're going to do some measurements with the edema. So we'll do that next session, but do you have any other goals other than just to decrease that edema? Any other goals or anything?
No.
No? Okay. That's fine. So we'll just focus on that. Other than that, do you have any other questions for me today?
No, thank you.
Okay, perfect.
Mhm.
That is it then.
Thank you.
Plasma.